this ear, the high concentration, was extremely hard, almost stone-like. And this can happen in between patients' own ears. So quite often you can get a patient who has soft wax in one ear, in the contralateral ear, they have hardened wax, just like this patient. So it's not uncommon. So I'm trying to use the hook to glide over the roof of the ear canal, over the wax plug, and once I glide over, I'm then rotating the hook clockwise by 90 degrees or so in an attempt to embed the tip of the hook into the wax and keratin plug, and then I can slowly remove it. Now, although the surface of this plug was hardened, the core of it was actually quite soft. So as I was rotating the hook, instead of extracting the wax and keratin plug, the tip of the hook just dissected through the wax and keratin plug, and instead of removing it, it just cut it up into little pieces, which can sometimes be helpful because I can then go back in with the microsuction tube. Okay, I'm here to vacuum out some of the loose fragments of the wax. And you may have seen there, I was trying to lift the bottom part of this plug off the floor of the ear canal, but it's really embedded. So I've reached out for the forceps as well, and I'm going to try and get the bottom jaw underneath this. You can see I've got a good angle there to work with, and I'm lifting it up, trying to detach it from the floor of the ear canal, but the skin that's attached to the ear canal and the plug is extremely adhesive. It's holding this wax in place. It doesn't want to let go. So now I'm going to enter with the hook. I'm going to go underneath and then rotate it anti-clockwise. I'm trying to get underneath it and scoop it up so I can separate it, which I have. And now I'm going to the back part of the ear canal, and I'm going to rotate it clockwise, trying to bring it through. This ear was slightly narrower near the entrance as well, which made it a bit more difficult. So again, just trying to get the wax plug from underneath and lift it up and away and off the floor, trying to mobilize this wax plug. Quite often when you're performing earwax removal, you're preparing the wax so then you can later remove it. It's not always about trying to remove it immediately. I've realised here we're going to have to loosen it, detach it. So I'm just trying to go all the way around. I'm now to the back part of the ear canal, and I'm trying to bring this wax and keratin into the centre. By bringing it into the centre, we're bringing it away from those side ear wall canals. And now I've reached out for the Jobson horn. I'm just going to go over and behind and trying to leverage this out. As I'm bringing out the Jobson horn, I have to accommodate for the curvature of the patient's ear canal. Otherwise, the Jobson horn will just make contact with the ear canal wall. So our ear canals are not straight cylindrical tubes. They have bends and twists, widenings and narrowings. And when you're in the patient's ear, you get a better perspective of their anatomy. So every time